what about hormone patches? We know that with patches, estradiol levels can be better than with pills, but not as good as with pellet use. They can be associated with adhesive problems. They need to be changed throughout the week. Some patch users experience weight gain, but generally there's less fluid retention than people experience while being on synthetic or horse estrogen. It's also important to note that 45% of people do not even absorb hormone through the skin. So, what about creams and gels? They too have the advantage of avoiding absorption through the gut, but they have their own problems. You have to wonder if you applied enough. You have to remember to rub it in daily and sometimes twice daily. They have a short half-life. They are applied topically onto the skin, but often people don't know how long they have to wait to get dressed. They can sometimes be transferred to others, such as babies and pets. Most important, estriol, which is one of the components of BioTE, doesn't even have the protective effects on bone, heart, and brain. Testim is an example of a transcutaneous testosterone product, which is used in men with low testosterone syndrome. Not only is this product expensive, inconvenient, and bad smelling, you can see on this graph that even at the higher dose, it only increases serum levels minimally. The goal of BioTE treatment in men is to achieve a youthful testosterone level of 800 to 1100, and we have no trouble achieving those levels with pellet therapy. So it is obviously a much more effective treatment option. Currently, another popular treatment option is injectable testosterone suspension. Injections can certainly increase testosterone levels, but they have a number of disadvantages. They can be associated with uneven absorption. They can be associated with a significant roller coaster effect. They are synthetic hormones, and they have significant adverse effects, including liver toxicity, coronary artery disease, prostate cancer, and many others. Anabolic steroids cannot be aromatized, and therefore they are very dangerous. This has been proven in many studies. They've been shown to elevate LDL and decrease HDL. Also, injections always wear off before the next time the shot is due. So why do we at BioTE advocate pellet use? Pellet therapy keeps the estradiol to estrone ratio at 2 to 1, which is the natural ratio. These hormones are biologically identical to the natural hormones that your body produces. They're derived from yams. These pellets provide hormone that is constantly available to the body. They're absorbed directly since they're not taken orally. They provide a steady state of hormones, so patients don't experience a roller coaster effect. They're associated with minimal weight gain, if any. They're safe and hassle-free. They provide for individualized dosing. And of course, they last much longer than any other treatments. Let's briefly talk about the history of hormone pellets. These pellets were developed in 1939 for women who had undergone radical hysterectomies. Historically, they've been widely used in Europe and Australia, but they're definitely gaining momentum here in the United States. It is well known that in order to optimize hormone deficiency symptom relief, one must achieve relatively stable hormone levels. It is best to avoid the peak and trough phenomenon. No one feels good when their hormone levels keep going up and down, giving them a roller coaster effect. The problem is that with all other methods, that is exactly what you get. A sharp rise in levels after the dose is administered, followed by a continuous fall until the next dose arrives. Patches and topical creams are better than, say, pills and injections, but nothing else compares to the smooth delivery from pellets, which last around 4 months in women and around 5 to 6 months in men. Besides the excellent delivery of an optimal amount of estrogen and testosterone in women and testosterone in men, pellets have many other advantages over other hormone delivery systems, such as they're associated with no increase in thrombotic activity, they reduce cardiovascular risk compared to oral therapy, they do not increase the risk of breast cancer incidence. We have known for decades of the relationship between estrogen and protection against decreasing bone density. However, what most providers don't realize is that testosterone is an even better protector against osteopenia and osteoporosis. In fact, studies have demonstrated the 4-fold increase in bone density over oral estrogen therapy and 2.5-fold increase relative to patches. In fact, one can achieve an 8.3% per year increase in bone density with pellet therapy, compared to a 3.5% increase for patches and only a 1 to 2% increase with oral estrogen. Let's address safety regarding breast cancer. The Nurses' Health Study was performed with 121,700 nurses, and it showed definitively that conjugated estrogens were associated with an increased risk of breast cancer, with a relative risk of 1.32. Studies have shown that estrogen plus testosterone in pellet therapy are associated with no increased risk of breast cancer. Another study was published in the Archives of Internal Medicine. It showed that oral synthetic chemical methyltestosterone increased the risk of breast cancer. Products utilizing this compound are Estratest, Estratest HS, Syntest, and Syntest DS. The study, however, showed that non-oral testosterone prevents the stimulation of breast tissue and actually lowers the risk of breast cancer. So not only is there not an increase in the risk, but there actually is a protective effect that was demonstrated in this study. This is much different than what we saw in the Women's Health Initiative when oral Prempro was the drug that was studied. Because of the controversy about hormones, and because this is such an important consideration, let me re-emphasize these points regarding the safety from a breast health standpoint. There are hundreds of studies, all with the same take-home message. Testosterone delivered by pellet implants does not increase the risk of breast cancer, unlike oral synthetic methyltestosterone. Testosterone implants have shown less stimulation of breast tissue, and treatment with testosterone and estradiol implants does not increase the risk of breast cancer, even in breast cancer survivors. What do we know about cognitive function relative to hormones? Well, we know that women get Alzheimer's disease approximately 8 times more often than men. We know that women on testosterone are 50% less likely to develop Alzheimer's disease. We know that men with low testosterone are 3 times more likely to develop the disease. We also know that testosterone use is the most effective treatment for memory and concentration problems, which are increasingly common as we age. So, those who want to improve mental clarity and memory deficits arising from menopause and andropause, as well as protect themselves from senile dementia and Alzheimer's disease, should strongly consider testosterone therapy. One symptom that many people don't realize is related to hormone deficiency is joint pain. It is true that joint damage is related to cumulative trauma to joint surfaces, but joint reparative processes definitely slow down with age and with worsening hormonal deficiency. In fact, 10% of men and 18% of women greater than 60 have osteoarthritis. It's been estimated that by 2020, osteoarthritis will be the 4th leading cause of disability in the United States. Science has shown us that chondrogenic progenitor cells are present in arthritic tissue, and that both estrogen and testosterone can stimulate these cells. Of course, in men, we must be concerned about any potential risks relative to the prostate gland. Studies show that high levels of circulating testosterone are not associated with increased prostate cancer risk. Also, that blood levels of androgens are not related to the risk of developing prostate cancer. One study showed that after 1 year of testosterone replacement therapy, men with PIN, a precancerous condition, do not have a greater increase in PSA or a significantly increased occurrence of prostate cancer compared to men without PIN. These results indicate that testosterone therapy is not contraindicated in men with PIN. So we've talked about safety, but what exactly can male patients expect from treatment with bioidentical testosterone pellets? Well, they can experience enhanced erectile ability, protection for the prostate, enhanced libido, protection for the cardiovascular system, increases in bone and muscle strength, cognitive clarity, lower cholesterol, increases in energy and vitality, a feeling of overall well-being, reductions in body fat, and relief from depression and anxiety. What about the positive effects of combination estradiol and testosterone treatment in women? Well, they can expect relief of hot flushes and night sweats, increased energy, improved libido, improvement in sleep, relief of vaginal dryness, bone protection, increased lean body mass, reduced body fat, breast protection, and cognitive clarity and long-term cognitive protection. So why is bioidentical hormone replacement therapy using the BioTE subcutaneous pellet method gaining such popularity and causing so much excitement? Because patients are talking to their friends, spouses, coworkers, and loved ones about their increased energy levels, restored interest in life, increased sexual desire and sex drive, consistency in their moods with relief from anxiety and depression, their increased mental clarity, their decreased body fat, and their greater capacity for getting the body in shape. I hope that you have found this video to be both informative and exciting. I have to admit that sometimes products and services are hyped up, and I'm a big believer in the saying that if it sounds too good to be true, it probably is. However, the honest truth is that bioidentical hormone optimization is extremely safe, extremely effective, and the bottom line is that it helps men and women lead much more rewarding lives. I wholeheartedly endorse it. I hope that I or one of my associates will have the opportunity to speak to you in person about BioTE. The placement procedure is quick and virtually painless, and we will quickly get you on your way to restoring youthfulness and vitality. Thank you for watching.